Right, this is the main entrance. Should we come through here? This is the main entrance where we used to have people waiting to go into minor injuries. So if I follow you through down this corridor to minor injuries. This is the minor injury room. Obviously only room to be able to see one person at a time. So that was minor injuries. Obviously, as I said, they used to wait down the bottom here. There was a small waiting room, but obviously the doors are very narrow, so with a big back, doesn't really give a lot of space for people to walk in and out. So this was the official waiting room. And then next to it is the toilet for the area, but obviously like that is not disabled friendly, it's very narrow doorway.
And what was people's reaction when they would have to use those toilets?
I mean, most people would comment on how small, it's a bit small, but obviously anybody with a wheelchair would have to go into the inpatient area, which obviously has some risk in itself of infection control, but obviously they're not great, the closest inpatient toilet. We've got here is the first side room, which we used to have 2 patients in. You could tell by the nurse call-bell system. Obviously, luckily we only had 1 patient in here. The difficulty is with this room is obviously it's right by the main entrance, and also there's no toilet. So actually for an isolation room it doesn't really fit the standard, and obviously the sluice is right at the other end of the hospital, so we in the end wasn't able to use this room. Right, we're leading now into the day room area. Obviously this ramp is here because that room there was no safe fire escape for the patients, because we can't get a bed. The beds can't go through the main doors or down the main corridor, so we had to create some sort of safe way so they can go out into the day room and into outside if needed. I can take you through to this bay, which is one of the bay areas where we have for patients. Just hold the door back. This bay originally had 6 beds in. You can see the 2 there, 2 in the middle, 2 at the end. Very, very tight. Particularly there with the heaters, you'd have lockers, bed and heaters. You couldn't get to both sides of the bed. You could only approach the patient on one side. Also, one of the problems with the curtains, like the patients in this bed and all the curtains are drawn, there's no other access to the day room, so you'd have to either go through the curtains or push the curtain, affecting the privacy and dignity of the patient in here. So we eventually reduced it down to 4 patients, but we still had that tricky bit around accessing the day room. And obviously any visitors come, we would have to walk through to the day room, and if there's a patient's poorly, there's no other option but they'd have to walk through. And then we come into the main corridor. The only toilet for that bay area was this one in here, which really isn't disabled friendly. So obviously if a patient was in a wheelchair or needed assistance, we'd have to open the door and put a curtain, a temporary curtain around here to provide some dignity and privacy. But obviously anybody entering the hospital, it's quite a close. They could look in if you're not careful. And obviously this is the main walkway, and anybody using upstairs would come through this way as well. Then we've got the bathroom. So that was one area that they used a lot, the bathroom. The one disadvantage was when we actually had patients here, it did have a lot of equipment because we couldn't have nowhere really for commodes or anywhere else to go from this room, so there was other stuff in here as well. But they did use the bathroom really well. Now we come through again to the other bay area. This area used to have 5 beds as well. We ended up restricting it to only 4, so 4 in a row. But obviously one of the biggest problems of here was the fact the sink, which is there in the corner, it was actually behind the curtain for this end bed here. So unfortunately, if you wanted to wash your hands and you were with somebody with a patient, you'd have to go behind the curtain to wash your hands, which really was not good infection control at all. But we tried to change the sink, but we couldn't because of the plumbing. And yet again, like with the other day room, the problem was the curtains trapped. If the patients were being attended to behind these curtains, anybody accessing the day room would have to go either behind the curtains or wait, which wasn't always easy. If you had a patient that wanted to go to the toilet, wanted to come to bed, it was not a bit of a challenge.
How was it for you and your team working in these sort of quite cramped conditions?
It was always a challenge. I think the staff tried to work well, but I think they were acutely aware that they were sort of respecting always the privacy and dignity for those patients. They were always very responsive when a patient wanted something, but it was very hard if a patient fell or wanted a chair by the bed. You were trying to squeeze in between because there just wasn't the space, because obviously each patient had a chair and a bed. They used the day room a lot, but it was a challenge, definitely in here.
And so what was it like for you and your team working in these sort of cramped surroundings?
I think it was very hard for them because I mean they always wanted to provide good care, but it was cramped. They were responsive, but we did feel it was a bit like working in the dark ages, you know, old-fashioned nursing, rather than, you know, any cutes of actor, because you just couldn't get round to the patients. I think it summed it up once for me when a patient explained that, you know, being here was like being at the Royal with Wendy Cragen, which is a very old programme of old-fashioned nursing. And I think that summed it up. I'll just show you our one remaining side room. It has got toilet facilities, but this was used for end-of-life care, but it has no natural light. It really is quite dark and dingy. There is a ensuite shower and toilet, but the ensuite shower is actually a domestic shower, so it doesn't fit for our patients. And there is a door right into the outside, which it wasn't and it is very far away, this room, from the nurses and the day room. So in the end we stopped using it. I mean, you know, patients didn't complain, but it was the area we had to offer.
Mm-hmm.
But it did carry its risk being so far away from the nurses' station, and you know, you'd have to make sure you were popping up on a regular basis to check they're all right if they weren't able to call you.